Okay, I hope you can hear me and you can see me. So look, I'm gonna do some flashcards. I'm back again. Let's hope it works. Define a COPD exacerbation. I assume it's acute worsening of patients' chronic COPDs. I guess this is pretty obvious. Cardinal symptoms. Yeah, what will be dyspnea? You'll have maybe some pain. Do you have pain? I don't think so. Worsening dyspnea, worsening cough, worsening of sputum. Okay, so everything worsens. What other history questions would you ask? Are you taking your medication right? I don't know what other stuff. Home medication. If you're smoking, changes to oxygen. Interesting. Prior COPD exacerbations in the past, intubations, home medication, home oxygen, smoking, prior emergencies like this. And we're going to do that again. Predictor for future. What is your most common COPD exacerbation trigger? Smoking. No, it's an infection, really? Actually, that makes more sense. That makes more sense, yeah. Common trigger COPD exacerbation triggers. We know infection. We know smoking. What's the other one? Pollution is just smoking. And then PE, okay, yeah, I guess. Pulmonary embolism, I think we can. Okay, I guess. Vital sign to check in COPD, other than your respiratory rate, is pulse oximeter. I mean, it's kind of debatable, right? Some people don't even consider that, but yeah, it's pretty important. Physical exam finding pulmonary COPD. What do you find? I guess. I mean, clearly you have wheezing, decreased respiratory rate. Or no, I think you have increased respiratory rate, and I don't know what that is so far. Okay, prolonged expiration. You do have your wheeze, and you have tachypnea. You have the timer. The big time, dude. Come on, you gotta go. You gotta go there. Three red flags for respiratory compromise, COPD exacerbation. Red flags are if there is decrease in the rate, I think, or normalization of the rate, something like that. Difficulty speaking, and then altered mental status, and then use of accessory muscles. Okay, well, walkie-talkie. You got your accessory muscle, and you're clearly altered in mental status. Okay. Again, test labs to order for a COPD exacerbation. What test would I order? An ABG. Yeah, yeah, makes sense. And then an influenza test. Oh, really? Okay. ABG. Well, yeah, it's an emergency. You would do that. Rapid influenza. Okay. Acid-base disturbance in a COPD exacerbation. I guess it's alkalosis. No, it's acidosis. Whoa. Goalie. Damn. I didn't even know that. Okay, well, I mean, I'm assuming the bag is for acidosis. Fine, cool. It doesn't matter. Just remember it. And let's do that again. Chest X-ray finding in a COPD exacerbation. What could it be? Do I have anyone online? I hope there's a few people. I don't know if there's a lot, but let's hope there are people like that. All right. Streamed 22 minutes ago. So that's it. Is that all you're gonna do? Okay. State C. What do you do? What is the management? I forgot. Let's look. Let's actually come back here. So I'm still live. Nice. I'm live. Dude. I am good at what I do. Oh no, it froze again. Did it freeze again? Uh-oh. How do I unfreeze it? Sometimes it doesn't like preview scaling, screenshot, copy, rename, filter, properties, and then it comes back like this. Okay. I wonder what happens when you try refreshing. Refresh. I think we should refresh. I think refreshing will help. Come on, refresh. Refresh the hell out, dude. I don't get it. We're still in this weird thing, and I don't like it. Why did it do that? I don't get it. It was going well for a while. Then it just goes back to this. Like, what do you do within that? I don't get it. But how do you oh man, I don't even know. Let's do this, okay? And then I guess you move it. Yeah, see? There you go. And then what do you do here? You gotta change it, right? I don't think Screen capture isn't doing anything. Advanced audio properties, whatever. Settings, restart capture. Can I restart it? Just cool. Okay. I'm back, bro. I'm back, dude. Look at me. Look at me. Okay, let's come here. Chest X-ray finding COPD exacerbation. What do you really get in a chest X-ray? I guess you would have. What would you have? I don't know. Hyper expansion with significant airflow. Where is that? I don't think there's anything here that suggests a chest X-ray showing widening. Like what? Okay, cool, dude. This is like a whatever question. Utility of ordering a chest X-ray COPD exacerbation. Utility, I guess. What? To rule out. Oh, that's the thing. We do a chest X-ray not to diagnose COPD. It's to rule out others. So it's important that we rule out others. Okay. First line thing. Oral meds, failed oral steroids, or has like an impaired. Yeah, whatever. What should be given for COPD exacerbation? Unable to take oral meds. Intralesional. What do you do? I mean, IV. Yeah, I mean, I guess. Like, cool. Antibiotics indicated for this one. It depends, right? It could be broad spectrum, moderate to severe, worsening of 2+ cardinal symptoms. I guess, yeah, when it's like moderate to severe. So severe that you assume there's going to be some infection. Or just because it could be infection, why not just give antibiotics? Okay, so let's do that again. The most common bacteria, we saw a few. We saw pneumonia, we saw strep pneumo, H influenza, Moraxella. Nice. I'm just good at this. I'm so good at this. I am the best. SpO2 is 80 to 92, I guess, especially when it's like here. What can overoxygen cause? I think. What? Depression of CNS? Yeah, hypoxic drive, as they call it here. So that's kind of hard. Contraindications in if it's a non-invasive, but you're giving PPV, what could be the real contraindication? Uncooperative, aspiration, facial. Okay. It's a facial abnormality, aspiration risk, and also if patient doesn't want to. So, so again, 3 respiratory support options. I know one is the face mask. There's nasal, there's a BiPAP, intubation. Yeah, obviously, if you can't do anything, BiPAP that. Yeah, I know. Okay, that was cool. Let's do that. That was kind of hard, was it? It was a little bit hard. How is moderate to severe defined? I guess it's worsening of 2+ symptoms. Yeah, I guess we just have to assume that's what they meant. All right, cool. Some common triggers for a COPD like exacerbation. I guess. No. We kind of knew this. One was infection for sure. Pollution, environment, and just your pulmonary embolism. Now, a vital sign to check in COPD exacerbation is your pulse oximeter. Okay. Some history questions that you want to ask a COPD exacerbation patient are you taking home meds? Home oxygen, how is it? Home meds, home oxygen. Oh wow, I can't remember what the other one was. I'm trying so hard to think. Are you like smoking? What was the other one? There's one that was like pretty. Yeah, you would get it. Like you would get. Oh, past history. Yeah, cool. Physical exam, pulmonary 3. We know one was. Why is it like so hard? Okay, it's like kind of. So we know expiratory, prolonged expiratory, wheezing, and then tachypnea. Okay. 3 red flags. One of them is. What was the other one? Wow. You know what? I feel much better when I'm not talking. But like, the thing is, I kind of need to talk to like engage myself. Otherwise, I'm gonna get bored and then fall asleep. What was it? 3 red flags. What did I see? I know one was the altered. Like if you're using respiratory muscles, altered mental status, and then what was the other one? Wheezing? No, crackles, right? Was it crackles? No, something else. Something pretty more like weird. You wouldn't think smoking? Difficulty speaking. Yeah, that was a common COPD exacerbation. Is your infection? See, I'm already bored. Is there anyone watching? I hope you please watch it. Whoa. Whoa, 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 whoa. Okay, whatever. Test labs to order a COPD exacerbation. A test or a lab to order? What would I want to order? Oh, yeah, I remember an ABG. Yeah, you're an exacerbation. And then I guess influenza rapid. Yeah, cool. Okay, good. Acid-base disturbance here is your metabolic acidosis. Oh, no, it's respiratory. Of course it's respiratory. What am I, an idiot? Okay. Utility of ordering a chest x-ray in COPD exacerbation is to rule out other diseases. Now, a first-line therapy, COPD exacerbation. What? The Saba. Okay, cool. Contraindication is non-invasive if it's like an aspiration risk or like facial abnormality or what's the other? Obviously uncooperative. When are antibodies indicated? If it's like really like moderate to severe. 3 red flags. I forgot walkie-talkie one. They have difficulty speech. Okay, cool. I think that's the most important one. That's obviously the most, because you're going to obviously talk to the patient, and you're going to find, that's like the one thing you will find out. So there's chronic asthma, SO. You have management, you have acute asthma exacerbation. It's, 2 of the most important topics here. You get to cover it. And let's all, you know what? This is also, one second, let me also let's just reset this deck. It's important that we reset it and then we change it to the Pulmo. Pulm and O. Cool. See, look here now. So 3 asthma defining characteristics of an airway. One was hyperresponsiveness. Inflamed? I think so. And then what was the other? Whatever the other one was. And then it's reversible. It is reversible. So let's do that as a Hardy. 3 classic asthma symptoms are, I know there's wheeze. I know there's like dyspnea. Obviously, what else? Sputum, not so much. I guess some dermatitis, but that's not enough. Cough, wheezing, dyspnea. Cool. Yeah, a little bit coughing. I guess you can go with the Hardy. Common triggers, asthma. We have nasal polyp. We have allergy in general. We have smoke. We have winters, I guess seasonal. Viral infections. Aspirin. Then there's one more. What was the other one? Nasal polyps. I don't remember. Cold air, cigarette, respiratory infection. Exercise, allergen, aspirin, beta blocker. Where was the beta blocker? There was a beta blocker. Wow. Yeah, I didn't even see it. So the squirrel holding a dandelion, that's an allergen. Snowman, cold air, and cigarette smoke, along with infections. Hey, that's like one image, 3 things. Damn, bro, I'm already getting like really sleepy. I have to complete this quickly. Describe the timing of asthma symptoms. Timing is, or would be, it's kind of acute. I don't think it's too bad. What would I say? Episodic, and it's at night. Okay, well, I guess it's episodic, and then new episode tonight, and episode and tonight. So that's where you get it. So let's do that. Let's do that again. If an asthma symptom occurs only at work, what does that suggest? It's occupation related. Some history questions. So, what would you want to ask? What would you really want to ask? I guess history of nasal polyp, and then something else. Trigger family, strep atopy.